Hi, my name is Carmel.
I'm Cindy.
And I'm Deanna, or Tiaga. Our medication is Alocitron, and then the brand name Lotrinex. So it's for IBS-D, and it's an antidiarrheal. So our objective is to teach patients regarding Alocitron. When they're taking the medication, we want them to understand the reason they're taking the medication, as well as the mechanism of action. So we want to talk to them about why they're taking it, go into detail of how the medication works. Also, we want to emphasize on the complications of the medication. So when they have signs and symptoms that relate to the complications, they can notify the provider as soon as possible in order to understand if they can continue taking the medication or stop. We also want to go over the interactions of the medication, because we don't want the patient to take a medication or have been taking another medication that interacts with the medication that doesn't make it as effective or more effective than what it's supposed to do. And then lastly, we're going to go over nursing considerations, because us as nurses, we want to make sure we facilitate the right education to the patient for them to understand the compliance to the medication.
Okay, so our focus today is to increase compliance, patient compliance, and education with the use of Alocitron. Okay, so we're going to talk about the way that the mechanism of action. Alocitron is used and prescribed for patients who have irritable bowel syndrome diarrhea. The drug works by inhibiting the activation of 5-HT3 receptors. It decreases GI activity, and it also decreases the visceral sensation. The purpose of the drug is actually to decrease GI pain for patients who suffer from irritable bowel syndrome. It also is to decrease the urgency and frequency, and to increase the stool's firmness.
To further educate our patient on the compliance and to teach them the education about Alocitron, we want to make sure we talk to them about the risks or the complications so they understand the risks. So as healthcare professionals, our goal is to emphasize on the main complications, so then when that patient is taking that medication, they understand the complications, and once they understand the complications, they can then provide or notify the provider about those complications if they have to disregard the medication or keep taking it. So some of the complications include, the main ones are constipation, which includes GI toxicity. It's bowel obstruction, ischemic colitis, impaction, and perforation. Another main complication is abdominal pain. So the highlighted ones, the constipation and abdominal pain, are ones we have to emphasize to the patient when taking the medication if they have signs and symptoms of those complications, to notify the provider as soon as possible. So when explaining the medication to the patients, you want to make them understand the interactions that involve taking Alocitron. So phenobarbital, you want to make sure they're not taking those because it decreases the levels, which doesn't make it as efficient. And then fluvoxamine, which increases the levels, which makes it more efficient and can lead into some of the complications regarding taking Alocitron. So whenever a nurse is explaining the medication to a patient, we want to make sure we look at the drugs they're already taking to make sure these two main ones aren't on there, so we can modify medication if we have.
So I'm going to be talking about nursing considerations. So our jobs as future healthcare professionals, it's important when working with a medication like Alocitron to include, yes, patient compliance, and just to inform our patient on all the risks that come with it when taking this medication. This medication does have potentially fatal outcomes when it comes to GI toxicity, so we want to ensure that our patient is fully aware of that. And they also do have to agree to a form that allows them to take that prescription, of them being aware of the risks. So the population that we're looking at for the administration of Alocitron is only for women, just because evidence-based practice shows that there are very severe fatal outcomes that have been showed in studies, that men suffer majority of the time from ischemic colitis. And so the criteria for Alocitron is going to be women who have suffered with irritable bowel syndrome, diarrhea, specifically diarrhea, for longer than 6 months. And then we should also inform our patients about the duration of time that they're going to be undergoing treatment If their symptoms haven't been resolved for 4 weeks when going through treatment, they're going to have to be stopped because it shows that the medication isn't effective.